Welcome to our webinar on brain-based diagnosis and treatment of autistic spectrum disorder. If you can hear me, since we have some of you muted, just raise your hand and see me. Okay, great. We have a lot of people that are going to be joining us, so I want to welcome everybody. And thank you. We had so many people trying to make reservations that our website froze earlier today. So if any of you had a hard time making a reservation, I thank you for your patience. I'm really excited to be talking to you. My name is Dr. Linden. I'm the Director of Attention Learning Centers, and I've been doing this for 36 years, almost 37 years. And we have been doing seminars for about 30 years, and we just started doing webinars in May. And we've kind of, instead of just big topics, we've had separate areas like anxiety. The last webinar was on attention deficit disorder and ADHD. This seminar is more on autism and autistic spectrum disorder, including Aspergers. Our next webinar, which is just being put on our website tomorrow, is going to be July 16th, and it's going to be about anxiety and depression, particularly during COVID. And my title is going to be Being Happy and Calm During COVID. So that's my topic for next time, because I've been getting lots of questions about that. So we're going to be talking about children and adolescents and adults. I'm really going to be sharing some really important information with you. For those of you that are on, these are the main points. We're going to talk about how autistic spectrum disorder and ADD are biological and genetic, how brain mapping and computerized testing leads to accurate diagnosis and successful treatment. We're going to talk about different subtypes of autistic spectrum disorder. It's very important. Between autism and Aspergers, there's 7 different patterns, and believe it or not, each type is treated differently. And we're going to talk about different types of treatments, particularly neurofeedback, how it's very successful as a long-term treatment. This is our 20th year working with autism and Aspergers with brain mapping and neurofeedback. We were the 2nd center in the world to do this. I've been very fortunate to have taught and lectured all over the world. In Australia, believe it or not, my last out of the country speaking engagement was in China at Peking University. Fortunately, it was not this fall, but the year before. And they were the first clinic in China to start doing these techniques. So these are being done much more commonly, but the way we do it using the QEEG is very unique. We're still one of the only 5 centers in the world to do it this way. And a lot of the things I'm going to be telling you today and sharing with you are things that might be new to you. This might be the first time you're hearing this. And a lot of the questions I get asked, well, why didn't I know about this? Well, there's a couple different reasons for that. First of all, your doctors may not want you to know about this. Some of the psychiatrists that prescribe medicine, because there's really no medication for autism and Asperger's, may not want you to know there's a way to figure out if a medicine is not going to help your family member. The pharmaceutical companies may not want you to know this. So there's lots of reasons why you may not heard about this, but I hope by today you'll understand our main points and you'll see why it's so important to look at your brain and test your brain, and why that's the only way to really get your brain functioning and improve all the symptoms of autistic spectrum disorder on a long-term basis without side effects, because our society is very lacking in this, and we'll talk about this. All right, so I'm kind of doing my introduction, and I'm the director of Attention Learning Center. We actually call it Linden Attention Learning Center now. We are in Southern California. We have an office in Laguna Hills, which is where I'm at now, in kind of the middle of Orange County, right off Alicia Parkway, and another one in Encinitas in the north part of San Diego. We have been an essential clinic. So we have stayed open during COVID the whole time. We work with people with autism and bipolar and seizures. So we've continued to work with some of our clients. We're doing it in a very socially distanced way. A matter of fact, the brain maps we do on Sundays now. That's the only thing we do on Sundays, other than this Sunday being Father's Day or some holidays like that. So I'm wearing masks, gloves now. I have my mask on if anyone walks in. So we require everyone to have a mask when they come in. So we've been able to stay very safe during this time. And we're getting a lot of interest because so many people have been cooped up. And now that things are opening back up, there's a lot of pent up need with the kids being home at school and not being able to socialize. So this is a very timely topic. So this is an introduction of me, and like I said, I've been doing this a long time. 36 years ago, I actually was certified in biofeedback and neurofeedback. So yeah, it's 36 years I've been doing this. Back then, our equipment wasn't even computerized. I start doing neurofeedback. I'm a licensed psychologist. I start doing neurofeedback in 1988. I did this for my dissertation. Part of our studies we did here in Orange County and at UC Irvine. And we developed the precursor to this brain mapping test called the QEEG for attention deficit disorder. We actually did the first controlled study in the world of this technique for attention deficit disorder back in 1993. Starting in the year 2000, we start working with autism and Aspergers, and we identified 5 different types of autism and Aspergers. We've added a 6th one, and that's something we've published in a couple journal articles and has been used all over the world to kind of develop the treatment techniques. I've published 3 book chapters and been very fortunate to get to speak all over the country and the world. And if some of you kind of looked at our website before, we have a video of a TV show I was on, The Doctors, which is pretty common scenario where a child was misdiagnosed with ADD, and then they thought he had Asperger's, and they tried really strong medicines like Risperdal, which is an antipsychotic medicine. We did the brain map. We also found out he had a mild seizure disorder. Seizure disorders are very common in autism. 1/3 of students with autism have an abnormal EEG, not with ADD, not with Asperger's, but sometimes you can't tell until you do the testing. So if you haven't watched that, go back on our website. It's right on the homepage. You can kind of click that. And there's also something I want to tell you about, and then we'll kind of officially get into the slides, is what we typically do, especially if we have a lot of people, is we don't have a lot of time for individual questions, and we have to keep everything private for HIPAA. Although we're allowed to do all of our consulting and remotely, and a lot of our techniques we do remotely. So we'll have a couple minutes at the end for questions, but what we do is that all of you that are here, you can go onto our website and click free consultation, and you can set up a 30-minute consultation with me. And it's something you can do. We can also kind of talk to you at the end. If you have any question, I have my practice manager, Jolie, and my office assistant here, Leanne, and they can kind of answer questions. And sometimes people want to get started right away because they've waited so long and school's out, and even I think our summer is going to be shorter with school, but we have some free time for most people starting right now. So this is the main points for those of you that kind of joined us a little late, and we're looking at kind of the biological genetic aspects, and we're going to look at brain mapping. We're going to look at neurofeedback. So So one of the reasons I'm so interested in this field is if some of you were there for my attention deficit disorder webinar, you heard that I had family members, my younger brother and sister. I diagnosed them when I was in college. They both were undiagnosed. My sister had the hyperactive type. Usually the boys have that, and my brother had the inattentive type. My sister was never caught because she was a very good athlete and she ended up becoming a professional athlete. My brother wasn't diagnosed because he was bright and got an MBA, and they told him if you have a graduate degree, you can't have ADD. But I had a journey with autism start about 5 years ago. And this is a local journey. This was my cousin's, the younger cousin that lives in the valley, and she had twins. And the twins were, one of them was progressing. They were both pretty active, and they had went to Kaiser, and Kaiser ended up diagnosing them with attention deficit disorder. However, they didn't just have attention deficit disorder. One of them wasn't talking. One of them wasn't looking at giving eye contact. So what we saw was, I said to them, I don't think that's right. I've seen them. Actually, I'm going to see them next weekend. So what was interesting is my cousin came back to me and says, Kaiser wants me to give them Ritalin. Ritalin doesn't help autism. They won't even give them a good test. And it's like, well, that's not right. I said, this is more than ADD. And she goes, that's what I thought. So she brought him to our center in Orange County. We tested him. He had 5 of the 6 patterns of autism. We got him a diagnosis. He started treatment. He did really well. He was able to get an IEP in the school district. He's now, I think they're just finished 3rd grade. He's advanced in reading. He has friends. So it's really important. You would think that autism is much easier and more obvious to diagnose than ADD, but it's amazing to me how often, if it's high functioning or the kids are smart or they have Aspergers. I mean, so many adults we have, some of them never even heard of Aspergers. So this is kind of the true story. And what I've learned in my 36 years is you have to do the testing if you suspect this, even if, it's not severe enough to get tested by the school or regional center, and don't wait, because the younger we get this diagnosed, the younger we figure this out, the younger we help, the prognosis is significantly better. And if not, there can be really long-term issues with social skills, communication, jobs, depression, and even violence. I'm sure some of you follow the news, and a lot of these shootings, they link to some students having ADD, or young adults are having Aspergers and depression. And the one that was up in Northern California, I think it was in Santa Rosa 2 weeks ago, if you heard the news, the parents said he had ADD and Asperger's, and it wasn't treated, and he ended up getting worse and having other issues going on. It doesn't mean that's common. It's very rare, but you really want to work on this sooner before people get frustrated and depressed and alienated and give up hope. So to me, part of the reason this is going on is we have a health crisis in our country. And this isn't just because of COVID. These are my slides before COVID. But we have a health crisis with COVID too. Our government can't decide what we should do. Should we wear masks or not? Should we get tested? Who should get tested? When should we stop the shutdown? What's the best treatment? I mean, even our national leader is out there trying these medicines and publicly talking about medications. Kind of crazy, isn't it? So you can definitely see the health crisis now. So this is some of the current statistics. 1 out of 4 people in our country are on psychiatric medications. Currently, it's 1 out of 3. COVID situation has increased this by 25%, especially for anxiety and sleeping medicines. 1 out of 10 students have attention deficit disorder or a type of it. 1 out of 36 students now this has autism or Asperger's. You know what it was 15 years ago? It was like 1 out of 1,000. Lots of reason for this. We'll get into a little bit. A lot of it is the better diagnosis and awareness of this, especially of mild types. Anxiety has increased 30% in children. Again, this was before COVID. I'm sure it's 50% now. But even though we have all this going on, we still, in my opinion, have half of people are undiagnosed because they're not getting tested, like my cousin was. I talked to someone yesterday and talked to the mom, and the student is 19 years old, and we were going to talk about scheduling for testing. And she says, well, what do I tell him? We've never talked about this. He's 19 years old. You know, he's in college. So that's one of the realities. So I feel pretty strongly about this because I feel like a lot of times we don't really know the accurate information. We're not told it. We're not told it right away, whether it's our healthcare system or insurance companies or pharmaceutical companies or doctors that say there's no test, there's no way to figure this out. And we really need a solution. And this is what's kept me passionate about this for 36 years and why I'm still doing this, because it's still, someone needs to say this. Someone needs to really be an advocate for all of our family members who aren't getting help and aren't getting diagnosed or just getting prescribed a handful of medicines without knowing what's going on. And you know what? It's common. There's a financial income of this. There's a financial aspect. Even right now, if any of you are in the financial area, if you look at the areas, the sectors that are doing well, there's a lot of healthcare. There's a reason for this, for masks and PPE, but there's a lot of research going on for COVID, but there's a lot of money in this industry. And sometimes that's great for things like cancer research or COVID research, but a lot of times it gets in the way of doing a good job and being thorough. Our healthcare system is very short term, not looking at long-term effects or outcomes. So here's something else we know. These are my older statistics. We know that very few people outgrow this. We also know, and this isn't news research, this is 5 years ago, that we knew ADD was genetic about 15, 20 years ago. Autism, in studies done 5 years ago, they found a very high genetic disposition. A matter of fact, what they find is if you have a family member with with ADD, there's a 14 times higher possibility that another family member will have autism. Are they the same? No, but there's some genes that are shared with them. So when people say, well, how did this happen? There's usually a genetic aspect. Now, are people always diagnosed? No. We didn't even know what Asperger's was years ago. There's a lot of bright people who are researchers and engineers and accountants, or that really, have high functioning autism and Asperger's. There's lots of CEOs of tech companies that I've met that have this. Some of them have come out in the public and mentioned things like this, or there's been articles about them. I don't know them in person, like Bill Gates and other people. So there's some strengths of this too. So let me explain, or any of you, I can kind of see some hands. Are any of you new to this and just kind of learning about this? If you are, raise your hand. Okay, I think, so I'll kind of go through these more quickly. So with autism, there's usually 3 core characteristics, things we're looking for. First is abnormal impaired development in social interactions. That might mean they don't have any friends. That might mean they're sitting next to other people and don't want to play with them or share. It can be very mild. It can be very severe. Right now during COVID, the interesting thing is the students with autistic spectrum disorder aren't as bothered by having to stay in all the time. for this reason, because they're not really seeking and missing their friends because they kind of like to stay home and look at the computer and play video games, for example. There's also an impaired development in communication, speech, and language. So there's some students with autism that are nonverbal. There's some that have a limited vocabulary. There's some people with Aspergers that are very bright, but they can't express their feelings. And then there's this other area where we call restricted behaviors and activities. And these are kind of red flags. The pediatricians are supposed to screen for this by a year and a half. So these are things like stimming or flapping your arms, lack of eye contact, banging your head when you're younger, walking on your toes. Those are real red flags, and the inability to communicate that can be picked up by a year. Now, everyone's different. Sometimes they're mild, sometimes they're inconsistent, but this is what the pediatricians look for when kids are young. And my cousin had all of these when he was 2, and it was very hard for me to believe by the time he was 5 that this wasn't obvious to the doctors he saw. You know how long they saw him for? 20 minutes. 20 minutes was the appointment he had. Like I said, that's kind of the managed care health system. So what about the thing with autism? It's usually there consistently by 3 years old. So there's these kind of other aspects, a lot of obsessive behavior, wanting to play with your Legos or your Pokemon cards and line things up, computer programs, things like that. When I used to, years ago, it used to be Thomas the Train. Always loved Thomas the Train, little kind of trains. So what about Asperger's? Asperger's is a very difficult diagnosis, in my opinion, unless you do the brain mapping, because there's certain things with Asperger's that are actually better than average. Your intelligence, people with Asperger's tend to be very bright. Many of them are gifted. Many of the students are in gifted programs. I raised my children in Irvine, and they went to a really good public high school, university high school, very hard academic school. It wasn't back then a very big social school. As a matter of fact, their sports teams and the big sports like football and basketball weren't that good, but they were known for their academics, and there was lots of students at that school that had Asperger's. They wouldn't be involved with social activities. They wouldn't go to the football games. They wouldn't go to the school dances. They would go to school, come home, and study. And you know what? They were good students, but it was more subtle with the social areas. And even their language, people with Asperger's are very bright and they can be very articulate. They could be a college professor. They could be an announcer on the radio, a narrator. But if you ask them to talk about their feelings, it's a whole different story. They can describe their feelings, but they can't talk about their feelings and express them. So it's something that's very subtle. People with Asperger's really are rigid usually, so they really get stuck in routines. And if you do something different, or you drive somewhere a different way, or you change a routine, it really, really can throw them off. Young kids are known to have tantrums as they can't express their frustration about that. So some of the subtle things we look for are like eye contact, not being able to look at you in the eye when they talk consistently. Our society is very set up for this, because if you go in a group of young people, everyone's sitting like this looking at their cell phones when they talk to you. So it's kind of more acceptable to do that now. It's very hard to read facial expressions. So as a result of that, our students with Asperger's, when they have friends, the friends aren't the same age. They're usually friends with younger kids, or they're great with adults. Teachers love them. They also have a hard time expressing their feelings. And it's very hard to have a two-way conversation about a subject, because if you have Asperger's and you are really into, let's see, bionicles, or you're into transformers, that's all you want to talk about. And if someone talks about the weather, you're going to go back and talk about that. You always, it's like your interest, you're not even aware that other people aren't interested in it. So a lot of times we don't see these symptoms and people don't come in until they're in high school, or a lot of times when a young adult's going away to college and they've never been on their own and they've never really had a significant relationship. We see this a lot in marriages. I have one of the things I do a lot is couples therapy and marital therapy with adults where one of them is Asperger's, and it's usually the guy, the male. And, one of our stereotypes is that men can't express their feelings, right? So it kind of fits into that kind of stereotype, but it's more than that. And a lot of people are relieved when they find out that that's one of the reasons they're having relationship difficulties, is their spouse might have Asperger's, and it's really hard. I'll show you some examples of that as we get on. So hopefully this is kind of making sense to you. So now I'm going to talk about brain imaging. And looking at the brain isn't new. This is something we've been doing in our centers for 20 years. This was one of the very interesting pieces of research that was done about 10 years ago. And this is an MRI study that's called a DTI, stands for diffusion tensor imaging, and it shows connections in the brain. They do this for head injuries and dementia, and we did some studies with autism. The student on the right is a typical student, and this is showing, like I'm pointing the left side of the brain. So you see there's an area here that's more in the left area, which is speech and language. And there's another area here that's the attention area in the front. And you can see there's a connection. You see these colors show how much the activity is. This is a student with autism. The student with autism, you see how that connection is missing? That's how, when you do brain imaging, and this is a research, these are very expensive. These are like $10,000 and you need a radioactive IV. So these aren't done clinically, just in research. But this is why you want to look at the brain. So with autism, since the speech and language is on the left side, with Asperger's, we find it the same pattern, but it's on the right side. The right temporal area by your ear is your social emotional area. So somebody actually asked me this on the phone today. They said, oh, my doctor said there hasn't been any MRI studies done with autism and ADD. The ADD study was done in 1996. So this study was done in 2010. So now this isn't practical to do. So, but here's another issue we have. And this is kind of, I guess school's kind of over, but it's going to start in a month and a half. So this is, how does the school know what to do, especially if it's somebody who has Asperger's? Students with Asperger's get in trouble a lot at school because they might be impulsive, and they often have ADHD also, but their social skills that are difficult, so they don't know when to say the right thing. So they say socially inappropriate things. And they also have personal space issues. So they get right in your face and they're hugging kids and touching kids. And it's very uncomfortable for other people, but they don't realize that. But one of the things we see with Asperger's, especially boys that are younger, because they get so frustrated, they have meltdowns or outbursts when something changes and they don't get their way. But if it's in their brain, it's not their fault. So this is a boy who's in the principal's office every week, and the principal says, Johnny, think about what you do before you do it. See what Johnny says there? By the time I think about it, I've already done it. Johnny could have ADHD. He could be impulsive. Johnny could have Asperger's and ADHD and not be able to control his behaviors, particularly in a social situation like the playground, which is very unstructured. This is why things like autism and Asperger's, sometimes in a structured class, if it's mild, you won't see it, but you'll see the social part of unstructured situations like after school programs or the playground. So what should we do? We should do brain testing. And this is my kind of joke in a way. It's a no-brainer to test your brain, right? We have the technology. The cost has come significantly lower. This one day will be routine, just like we get a blood test and a checkup every year. So let me tell you more about this. In our office as Attention Learning Center, we usually do two main tests for our individuals. The first is an attention test. It's called a continuous performance test. It's a very boring test, but it's very easy. We have versions for students as young as 4 all the way through adults in their 80s. So what happens is you, some of you may have taken this, if I know there's some people here who have taken this test before. You typically will see or hear something, and you like our test, you'll see a number 1 or hear a number 1 and see a number 2 and hear a number 2. And you have to click right away to show you're paying attention and not click if you don't. It's super easy, but it bores you out of your mind. And some of you were on my webinars on ADD a couple of weeks ago. I call ADD interest deficit disorder. So it's a very boring test. And if someone has ADD, like this adult, these numbers here, this should be up here at 100, that's average. Anything lower, this is her problems paying attention and being impulsive and hyperactive. So she had problems with attention and hyperactivity. And we get all these scales. All these scores should be 100. Anything less than 100 is low. So this measure said she was impulsive, she was hyperactive, she had a hard time paying attention. Her focusing score was a 69. If that was a grade and average is 100, that would be an F. She was never diagnosed. She actually came in for her son who had ADHD. And then as happens a lot, she said, oh, I wonder if I have this. And she told me all the history of her as when she was younger and all the difficulties she had. Now, when we started working a lot with autism and Asperger's 20 years ago, I started doing this test with students that had autism. Can you see how this pattern is very different than the other one? If you're still looking at this, how many of you can see how low these bars are? Go ahead and raise your hand. I just want to see if you're still paying attention. So what happens is this test isn't just an attention test. It requires you to transition very quickly. Click, don't click. Hear a 1, see a 1. And people that have autism and Asperger's, they can't transition that quick, which is why it's really hard to stop something and start something or change your routine. So what happens is after a couple minutes, they can't keep up with the test and we get these really low invalid scores. Now, if somebody has Asperger's, the typical pattern is even different than this. If someone has Asperger's and they tend to be bright, we get the opposite pattern. We get scores that are above average. Why? Because they over-focus and they can really do a boring task very well, which is why so many of our adults are accountants and the main kind of career is engineer, software engineer, mechanical engineer, something that's very detailed, very good with numbers and math professors. And so if you have ADD, that would bore you out of your mind. I think I've only met one accountant with ADD in 30 years. So, because you have to be very detailed and deal with all the boring taxes and all the stuff that, how many of you have done your taxes yet, by the way? We have an extension, but that's another story. I did a group once on April 14th, and taxes were due the next day, and I had 10 adults in the group. And I said, wow, I didn't think I'd get so many people because taxes are due tomorrow. I'm assuming all of you have done them. Nobody in the group had done them. A couple people, one person said, I never do my taxes. Someone else said, I'm going to do them tonight. I mean, it was like 8 o'clock at night. So we ended up canceling the group that night so people could get work on their taxes more. That's procrastination. But if you have Asperger's, you can really over-focus and you're not going to see it on an attention test. But we are going to see it on the brain map. How do we see it on the brain map? And I'm going to show you what brain mapping is. Some of you have watched the video or maybe have met with me before. So what the QEEG is, EEG are your brain waves, Q is quantitative. So the Q and QEG mean we're doing statistics on the brain. So what kind of statistics do? We look to see at all this research. This field isn't new. There started being research in the early 90s. A lot of the initial research was in New York University. They have what's called a neuropsychology brain lab. And they did research in ADHD and in depression. And some of the research we did here, there's been some in Russia and some in Australia, so it's international now. And one of the things we've seen is that it kind of goes across all cultures and all countries, which is good. What we do now is a 19-channel EEG, just like you would see a neurologist. We do it in a chair, like I'm sitting in. We don't have to shave the head. We have no radioactive IVs like MRIs or SPECT scans, and you sit in a chair and you open your eyes and you close your eyes. So it's pretty easy to do. Again, I said earlier, we can test as young as 4. And in doing this, we have really been able to see a lot of insight into the brain. And we've been able to discover these different patterns. So remember I told you with statistics on the brain, we get 350 pages of maps and pictures and statistics. This is just one of them. This is what we call a theta beta ratio. And people say, what does a normal, quote unquote, normal QEEG brain map looks like? All these numbers are usually less than 4. And when we look at the brain map, what we see is we see these colors green. At the bottom here, you see what looks like a temperature scale. And this is either the new ones go 3 standard deviations out. Any of you remember your statistics? So this is like the bell-shaped curve. And what we do is we do norms on the brain waves. So we know what a 5-year-old boy's brain wave should look like. We know what a 60-year-old males would look like. And we, like I said, all this research, we know what ADD patterns look like or autism. And we did the research here for autism and Aspergers. But what you want to see is mostly green. Does anyone have a perfect brain? No. Everyone's had some bump or something happen, and some of it is genetic. But this is the nose. You can see at the top, this little bump is the nose, and the ears are on the side. And each of these little dots is where we put one of the electrodes when we record the EEG. We're not putting anything into the brain. We're just doing a recording. So this is what you want to see. I think I usually show little examples of ADD too. So I was telling you the research with ADD, we did some of it here in Orange County, but it started at New York University. And what others have found, and Dr. Amen, some of you are familiar with him, he's found similar things, is that there's at least 4 types of ADD. An inattentive type that's more daydreamy and distractible. A lot of women and girls have that are not diagnosed. A hyperactive impulsive type, a type that has anxiety with it, and a type that has depression. Now, why is this important? Each of these types responds differently to treatments. One medicine might help this type, do nothing for this, and make this person worse. So typically our standard of care in our health system now is that you just guess which medicine to do. Not even everybody responds to medicines if they have ADD. We'll talk about that in a little bit. So remember I showed you the map that was all green. This is a typical adolescent with ADHD, and you see all these bright colors in the front here. That's red. It means there's too much of this slow activity. We call it theta in the front of the brain, which is our frontal lobes. That's where our executive functions are. The problem is if you just look at a symptom, you can have the same pattern, but you can have the opposite system like this. You can have the opposite pattern where we have all this red activity in the back, which is when your brain is too fast. Same symptom for a child. Hyper, impulsive, can't pay attention. Opposite biological reasons. This is the statistics like I showed you earlier, and these numbers are like 4 and 3. They're above our cutoff. Well, let me explain to you why this is so important. This person's brain is under aroused, underactive, and they need it activated. But they really need it activated in the front, where the frontal lobes are. This person's has the same behavior, same symptoms, but they need their brain calmed down, but it's in the back. You can't say, okay, I'm going to inject a medicine here and calm this part of the brain without affecting the other part, and you can't activate this part of the brain without activating your whole body. That's why there's so many side effects, and our standard of care is so unsuccessful in our area. What about autism and Asperger's? As I was telling you, when we started doing research in this 20 years ago, we collected data over 13 years, and we published this in a book called Images of Autism. I think Springer's the author. I think we have our website, although our website's going through a modification now. We found out it was much more complicated. Many of us call it autisms with an S. There's 6 different patterns. Our 2 most common patterns are high beta, which is a lot of fast activity, getting stuck in things, over aroused, and also a different pattern, which is connections in the brain. There's parts of the brain that are underconnected in the front that have to do with attention, and parts in the temporal areas that relate to mood and behavior and social skills that are overconnected. 80% of people with autism and Asperger's have these connection problems. Only maybe 15% of people with ADD have that. Another common pattern is a slow activity like we see with ADD, but instead of theta, it's really, really slow. It's in a brainwave called delta. If any of you took psychology classes, neurology classes, you might remember delta is really high when you're sleeping or you get a head injury. Earlier, I talked about how common it is if you have autism to have a seizure or abnormal EEG. 1 out of 3 students, not adults, with autism, more general autism, not high functioning or Asperger's, have an abnormal G or seizure disorder, and it can look just like autism or anxiety. The boy in our video and the TV show on our website had that. There's another pattern we call the toxic metabolic pattern. And in our research, we found this was the least common subtype. And I'm very happy about that because this kind of has an environmental influence. A lot of people for years wonder what the cause of autism is, and we still aren't 100% sure, but we know that there's a lot of genetics involved and biological factors like parents having kids when they're older. But there was a theory that some of the mercury in the vaccines and things environmental were causing it. And there's a pattern we see when the brain waves are very small. We call it a low metabolic toxic pattern, but we've only had a very small percentage of people have that. So let me show you what these look like. This is a student with autism. I'll show you some examples. He's 6, and you can see all this red activity. This was the student that was featured on an NBC TV show called Autism, the Hidden Epidemic about 15 years ago that we were on. This is another student with autism. Again, look at all that red fast activity in the front, but also in the left side, which is the speech and language area, and the right side, which is the social emotional area. So the second thing that brainwave helps us figure out, what areas do we need to treat? Do we need to work in the front? Or with autism, we almost always work on the left for speech and language. And for Asperger's, this is our social emotional area. This is when we really zoom in on our brain maps, we look at each speed separately. This is, each little circle is 1 speed. These are the real slow speeds. This was a 15-year-old boy who didn't talk, but he was a professional artist when he was 15. Many people with autism who even aren't verbal, they're very good in art and on the computer and drafting or music. even without being able to speak. This is another pattern where instead of the fast activity, we have a lot of the real slow activity in these circles on the left. I'm just giving you examples. This is a pattern where you have a lot of fast activity in the front and the temporals, but we also have slow activity. But why this is important is everybody's different. This person needs this part of the brain calmed down and this part of the brain activated. There isn't really a medication to work on delta. Like I said earlier, seizure disorders and abnormal Gs are very common. This is a 6-year-old boy who was having some speech problems and social problems. And you want your brain waves to look kind of flat like this. You see these little spikes where they hit each other. That was some of his abnormal EEG pattern. So this is an awake EEG. So we sometimes we pick this up even in a screening, and then we have if a neurologist do a kind of more thorough sleep EEG. Some people have those done kind of as part of the diagnosis. So this is important to look at, and this is why you don't want to be treating the brain of someone with autism, especially with anything stimulating, because that could aggravate this pattern. And even with neurofeedback, there's like 70 types of neurofeedback, and we can actually treat the seizure disorders and seizure patterns related to autism very successfully. I'll show that to you at the end. This is another boy that had a lot of slow activity, delta, and a lot of this high beta where the red is. This is that pattern I told you that's the least common, the low metabolic, but what you notice instead of spikes, you notice all these brain waves are very small. So you can see there's lots of differences here. Now, what about Asperger's? Asperger's is kind of unique because it's just this right part of our brain or social emotional area that we see kind of deficits in. The left side is pretty good. So in a brain map, we might see this red and orange as slow activity when we might see it by the right ear, but not see it as much on the left. Or this is another measure that was done at UCLA, and you can look at all these kind of right where these bright colors are, which is by that right ear parietal temporal area. This area means it's disconnected from all the other areas in the brain. This is another name for coherence called co-modulation. In our maps, we look at a measure called coherence. This is a different graph where it's white's average, orange is high, and blue is low. But you see these connections here? Blue means 3 standard deviations, like in the 96th percentile problems connecting between the front, which is our attention center, and this right area by the ear, which is our social emotional center. Remember I showed you that MRI at the beginning? It's kind of like that. So, but we can train this area. The amazing thing I'm going to tell you in a little bit is if we put one sensor here in the front and one on the side, we can train this area to get connected, see physical changes, and see social and emotional symptoms improve long term. That's the exciting part of all this. Here's an adult, and the adult had the same pattern here. This adult was a software engineer, and I'll never forget what he told me. He said, Dr. Linden, feelings are like a foreign language to me. I understood that. So I said to him, well, if we can get your brain working better, this is one of the obstacles in learning the language, then you can learn the feeling words. And we did that, and then we did some therapy with him and his wife. This is an 8-year-old boy that was mistakenly diagnosed with ADHD, got in trouble at school, got suspended from school, had no idea why. When I talked to him, I said, what happened? And he says, I don't know. And I said, were you hurt? He says, no. So he got in an argument with the boy. I said, was the other boy hurt? No, he wasn't hurt because he wasn't crying. I said, I don't get it. That's not what your mom told me. What did the principal say? Principal said I didn't act appropriately socially. And I said, well, what happened? He says, I'm going to tell you a story. And he tells me his story in a monotone voice, like a narrator. What he said, well, we were supposed to build something together in a group, and the teacher said we had to follow the rules. kids with Asperger's are like little policemen. They want everyone to follow the rule, and they'll tell on other people who don't. And he said, we were supposed to share, and I wanted to build a Star Wars fighter jet. And the other boy wanted to build something easy, like a car. And he took the blocks, and I said, give them back. The teacher says we have to share. And he took it again, and he says, let go. So I let go, took it concretely. And it said the block hit the boy in the head. I said, was he hurt? Said he wasn't crying. I said, that's not what your mother told me. Oh, he was bleeding. He was bleeding, and it started here, and it was a bright red color. It looked like the roses in my mother's garden. And he told me the scientific name for the rose. Said, is there more to the story? Yeah. The blood went around his ear. It wasn't a serious injury, but he's a description, and he went around his ear. It looked like that American African earthworm I saw on National Geographic the other night. It's my favorite show. Do you watch that? I said, no. And he tells me the name and the species of it. Meanwhile, no emotion, just like he's a narrator. So I asked him the magic sentence. How do you feel? How did you feel? He never got sent to the principal. How do you feel? And he looks at this list of faces I have. They're like emojis. And I gave him 5 minutes. I said, just pick one. You know what he says to me? I don't get it. What are feelings? That's what it's often like to have Asperger's. It's like a foreign language. You can describe the situation, but you can't express your feelings, which as you get older really makes it hard to have a relationship. We actually work with athletes that have Asperger's. This was a professional surfer that, if any of you are surfers, he was very famous, and they made a movie about him, Clay Marzo, and they wrote a book, and we helped diagnose him based on the brain map right here in Orange County. And how he got referred to me is he was the most technically perfect surfer in the world. He could do 360-degree turns on the waves, but he wouldn't socialize. He wouldn't get, and he needed a sponsor. So he was over here in Anaheim, and they had the surfing awards in, I think, the Grove near the Anaheim baseball stadium. And he gets up to get an award, and he walks out like a robot and says, thank you. And he turns around and walks away, doesn't give a speech, doesn't thank anyone. And people in the audience are like, we don't want to sponsor this guy. You know, he's a jerk, but he wasn't a jerk. Somebody in the audience knew about my work and had come to one of my seminars and says, I think he has Asperger's. They worked for Quicksilver, and back then Quicksilver was connected through Saddleback Church right near them, where I kind of run support groups, and they referred him. And when we tested him, we found this pattern, all this fast activity. We found ADD, we found all these disconnections in those areas, and we diagnosed him, and he wrote a book, and his mom wrote a book, and he's really well known for being one of the first professional athletes to kind of explain his Asperger's. So anyway, here's the bottom line. Once we know that, we can really use the brain map to look at the type of autism or Asperger's or ADD, and then we can really come up with the best treatment. So that's what I'm going to kind of do in our second part, which is shorter. What do we need to do? Years ago, when we first learned about this, we thought kids and people would outgrow this. We know it's not the case. So our goals are to resolve the symptoms long-term without side effects. Even with ADD, only a third of kids are good responders to it. With adults, it's less. And we know that some medicines have tolerance. They found that out a couple years ago. This is a slide for the medicines for autistic spectrum disorder, and I've had this slide for 14 years. It really hasn't changed. There still is not a medication developed specifically for autism. Risperdal, the very strong kind of antipsychotic medicine that the boy on our TV show Noah was on, is approved for autism, but it's very sedating. Side effects like weight gains of 30 or 40 pounds. Stimulants are prescribed for kids that are hyper, like they try to prescribe to my cousin's kid, but they're really not effective because their brain's going too fast. A lot of the doctors try some antidepressants like Prozac and Celexa and Lexapro. One of the newest trends is these old-fashioned high blood pressure medications like Intuniv and Clonidine and guanfacine are used. They kind of calm the brain down. They can sometimes really help with behavior, but they don't help communication and attention. Matter of fact, they kind of sedate you. Um, and one of the disadvantages of medicine, even for ADD, is it only works when you take it. This is a child's locker, school, or an adult's closet before and after they take medicine. And I'm going to see if any of you can see the difference here. Kind of a trick question. Some of you were on my last. There is no difference. It's only when you take it. So very few people stay on medication for their entire lives, and sooner or later the kids go to school and they don't want to take it. Your insurance company says, you know what, we're not gonna, there's a generic. If you want the brand name, it's $300 a month. It's kind of crazy. I've had that happen with 2 of my allergy medicines, and the generics don't work as good as the brand names a lot of times. So it only works when you take it. So what I'm going to talk about at the end is what we've been doing for 36 years. I've been doing for ADD and 20 years for autism and Aspergers. It's neurofeedback. We used to call it EEG biofeedback. It started in actually right here at UCLA for seizure disorders. Dr. Sturman did it in the 70s, and Dr. Lubar started working with ADHD kids. They used to call them hyperactive in the 70s. I met him in 1982. And that's how I kind of got into this field right when I was out of college. And I had the first computerized neurofeedback system in the world here that we started doing our research with in the late 80s. And some of the studies, Dr. Lubar, who's now retired, has shown that 10 years later, there's a follow-up study. The effects of neurofeedback were still significant in 15 out of 16 areas. In autism, our success rate is rated very high, especially if you're doing the testing like the brain map, and the benefit to harm ratio, which is how many people get better versus side effects, is the highest ever studied. So there's lots of research involved, and I'm going to go over a little bit of it, but our website's being updated. We usually have hundreds of studies on our website. Let me tell you what I've learned over the years. I've learned who's a good candidate, who's going to do better, because not everything works for everybody, but when we follow these, our results are very, very positive, like 90%. Our minimum age, we can work with kids as young as 4, not all of them. We can do brain maps and QEGs with most of the kids less than 4. We've developed some special techniques. We get people that come from all over the world to get this done because other centers can't run them. We want to make sure they have a clear diagnosis, but a lot of times we're the first one testing them. And some of the things that we know make it harder. If an adolescent's really depressed, like suicidal, we would want to work on that first, obviously. If someone's really severely oppositional, like if they're aggressive and hitting, usually if that's the case, you've had a behavior therapy or some sort of treatment that calms things down. Usually you have to do neurofeedback a minimum of twice a week to get a good result. So we work with people from all over the world. For people that don't live within an hour, we have a remote option where we can start it in our office and we can run the sessions over the internet with web cameras, and you come in the middle and the end for our kind of retesting and monitoring. We like both parents to agree with this because, first of all, sometimes, and this isn't unusual, one parent thinks someone has autism and the other parent doesn't, or Aspergers. So doing the brain mapping is nice because it's like looking at an X-ray. You get the objective data. So we want to do that, and we want to get support of as many people as we can for this. So what does the neurofeedback look like? This is one of our screens, and the technology is a little different now. So this is the brain waves here. This is one channel instead of 19. And we take the EEG and we break it into different speeds. The red bar is your slow activity. So if you have attention problems, it would be high if you daydream. If you have autism, it's at high delta activity. The yellow bar is if you have ADD, if you're more hyper, or if you're more anxious, or for students with autism and Asperger's, is when they overfocus. We want those lower, and the green bar is your calm attention. We want it to get higher. And our equipment measures it and breaks it apart. And we get feedback every second or so. And these little light lines are our goals or our thresholds that we set. And everyone's different. We set a location and speed. So this is where there's like 75 different options that we base the testing on. And what you want to do is get your slow activity. They colored it red. We used to have just red light and green lights and yellow lights. And the yellow below the line and the green above all at the same time. And when you do that, you get feedback. The feedback might be in the version of a point or a beep you hear. And there's a display or a game that moves to the next frame or a movie that plays. You're not using your hands. You're not using your joystick. So it might look something like this. And I'm going to hopefully, you're going to be able to hear it too, but you definitely are going to see what happens. So watch what happens as the boys calm when the yellow and red bar lower and the green bar gets higher. Watch what happens to the animation of the game. Let's see if I can get it going here. Whoops. This is where I had a hard time. So this is a movie, and the movie should get bigger and louder as he does it. Whoop. Okay. That is too bad. We've been having some internet problems this week with some of the carriers here. So let me explain what happens here. So what happens on this screen is as these bars change, this game gets bigger and there's a beep, and that's the reward, or there would be like a movie, a video, and the movie would get bigger and play louder. If you're moving or your kind of brain goes too slow, it gets small like this. If you're getting stuck and your brain goes too fast, it gets small. If you're calm, it gets bigger and louder. So it kind of plays as we go through. And if you want to see some of this, it's on our website on our video. So what we found over the years is that compared to ADD, especially our young kids with autism have needed more sessions. And we've had to use a lot of behavioral strategies. Sometimes we have to start with biofeedback to help them be calmer. The results are more gradual, but they're much more significant. We see many children start to talk and communicate. Their social skills speak better. They make friends. They have their first girlfriend. Some of our young kids actually get kind of infatuated with their therapists. And a lot of our therapists are kind of right out of college, and they fall in love with our therapist, which is their first kind of feelings. Their anxiety improves. Even their seizure patterns improve. I'll show you some of the maps. This is the screen where we're doing biofeedback and neurofeedback together. And so this is a boy who was 14 years old. And when he came in, he didn't talk. He would just rock back and forth in his chair and just say, "Can I go now? Can I go now?" in his high-pitched voice. After the 40 sessions, all this slow activity right here and this fast activity, after the 40 sessions, the brain map looked like that. He was on Concerta and Wellbutrin, 2 different stimulants, which shouldn't have been done to begin with. He got off all of his medications. He was mainstreamed into classes. He was getting A's and B's. But this is the amazing thing. He started talking to me. And when he was done, his mother says, "You're not going to believe this. He's like a different person." And he sits there and he says, "Dr. Linden, thank you for the neurofeedback. It's really helped me. I'm in regular classes now. And I knew I wasn't dumb, but I couldn't talk. And now I know I'm smart." We were all kind of tearing up and crying at that point. And then he says, "And I discovered something new." He had just turned 15. What do you think he would say? "I discovered girls, and I like girls, and I want to get married." And he points to the neurofeedback therapist there. And the neurofeedback therapist was 35 years old. But at least he was aware of his feelings. So that's what I said to the mom. Well, now he needs social skills because we want him to know it's more appropriate to have a teenage girlfriend. But that was a step. This is another boy that had, this is the professional artist that had so much of this slow and fast activity together. Look at all the medications he was on when he came to see me. Risperdal, Depakote, Prozac, Ritalin, Neurontin. He got off all of his medications. Now, you might be thinking, wow, this is pretty amazing, and it is, but none of these medicines are treating autism anyway. Remember, they weren't developed for that. He was able to get rid of his aid and start speaking more. This is another boy that had the boy in the NBC special, The Hidden Academic, that had all that fast activity, and most of that improved. He was on 3 different antidepressants. Again, just trying trial and error to see what's working. And then afterwards, his social skills improved a lot. This is another boy who had seizure activity with his autism, and he had these spike discharges. And when he came to see me, I think he was 8. And the problem was that he wasn't talking in class. We ran his neurofeedback and his EEG pattern normalized. And it says the spike activity seen is no longer noted. So you know what happened to his behavior? He started to talk, but he went too far. He learned about jokes, he got a joke book, and he told jokes all day long in class. And now the school was complaining he was talking too much. You know what I said? This is a good problem. We can do behavior modification and social skills and teach him what's appropriate or not. Last year, he wasn't talking. So these are the things that we can see when we treat the brain directly and we know what somebody needs. This is a college student, and he actually had ADD and Aspergers, and he was very anxious. He had meltdowns. He had a lot of anxiety attacks. And this was his brain map at the beginning. All this red is the ADD, and this is his Asperger's. And you can see all the red. And after the neurofeedback, his map was a lot better. And this is his, I think I have his IVA attention test, and he had a hard time getting things done in time. This number here is his reaction time. He was very slow. It should be 100. And after the neurofeedback, it was typical. He went away to school, was successful in college, got a girlfriend. The interesting story is he comes back and he says, Dr. Linden, I have a girlfriend. It's great. He says, I'm in love. I said, wait a second, you've only been in school like a couple months. He said, yeah, I know. I said, give it a couple months, you know, you need a little more time to make sure. And then I saw him over the spring break, and he comes back and he says, Dr. Linden, I broke up with my girlfriend. And I say, I'm sorry to hear that. He says, no, it's okay. She was too dramatic for me. Matter of fact, I think she has not only Asperger's and bipolar, she's a lot worse than me. And I showed her your website and I gave her your business card. True story. He didn't even know what drama was when he came in, because that's like an emotional issue. He said, she's not a good selection for me. She's not healthy for me. I said, wow, that's a lot of progress. So this is another student with a girl that had autism. And you can see where my pointer is, all this slow delta activity. And these 3 bottom circles I'm pointing to were her brain going too fast. And after the neurofeedback, all that red had improved. And she had this is her disconnections, that low coherence, all these blue lines. And you should have no blue lines, especially thick. And after the neurofeedback, it dramatically improved. And she actually did really well in school. This was her IVA test, and it had that abnormal pattern I showed you at the beginning, because she couldn't transition. And after the neurofeedback, it normalized again. So these are the results we get a lot, and this is our goals. There's a lot of research on here, and I want to kind of keep time for questions. But we've done lots of studies that showed IQs improve, hyperactive behaviors, which are high, get better from neurofeedback. Hyperactive and attentive behaviors get better. Lots of research with ADD. There's been about 40 studies. One of this, there have been studies on MRIs and evoked potentials and meta-analysis studies. With autism, the research started in the late 90s, a little later. Dr. Jaworczyk in New Jersey did the first study before there were brain maps, and this was a quote from her. ABA therapy takes years to produce results. Neurofeedback only takes months. When we start doing the QEG, there was a lot more research, and I was involved in a lot of the initial studies with Dr. Coben, and we did some review articles, and we looked at coherence training. A lot of it was done at the University of Louisville. Dr. Coben's study was really exciting in 2007 because he had a big group of kids, and he showed there was improvements with neurofeedback in lots of areas. 91% of parents said their behavior was improved, and their attention was significantly improved. Their executive function is significantly improved. That's the problem with the sedating medicines. It makes that worse. And his conclusions is that this was a very, very important area to look at. And he looked at this statistic I mentioned earlier called the benefit to harm ratio. The benefit to harm ratio is how many people get better versus how many have a side effect. So a stimulant medication with someone that has autistic spectrum disorder, one person gets better versus one that gets worse. That's not a good percentage, is it? Risperdal, which is approved by the FDA, is 3-1. Neurofeedback, 91-1. So if we do the brain map, the QEG, and we do the test and we really individualize it and guide it carefully, it's extremely successful with really no side effects. So this was exciting. This has never been replicated with any other treatment to date. Some of the newer research we actually did here, and I'm going to finish with a study on MRIs that we did. I did this in conjunction with Dr. Panetta at University of California, San Diego. We did some of this kids down there, and we did some of them at a private school in Buena Park called the Speech and Language Development Center. These were students with autism from age 8 to 17. And we did a couple different measures. We did those MRIs, DTIs, because they had a big grant from the government. And it's kind of hard to see, but the left area here is the language area. The right area is the social emotional area. This is before. Afterwards, as these colors get brighter, yellow and red, you see the language area and the social emotional area are working better. They're more activated. That's what you want to see in an MRI study. They found the same thing with ADD and more of the frontal lobes. So this was really exciting to see. They also looked at this coherence measure, those connection measures, and these aren't my slides, so I think they're kind of confusing. That this is before and after, and this is a group of typical kids compared to the kids the same age with autistic spectrum disorder. You see all these little minuses? Those were areas that were disconnected, and afterwards, all those areas were normally connected. That's a coherence measure that I was showing you with the MRI study and the coherence. But neurofeedback is not an easy thing to do. It's very complicated. Like I said, there's like 75 different types of neurofeedback we can do, and we have to deal with some people on 5 medications and head injuries and seizures. However, it's unfortunate there's no license required to do this. So there are chiropractors that do this. There are people that do this out of their house. They sell equipment on the internet that can activate someone's brain and make things worse, because most people with autism and Aspergers, their brains are going too fast. There is a certification board called Biofeedback Certification Institute of America. I was certified in 1984. I'm now a senior fellow, and I teach lots of classes here and across the country, and I've taught probably hundreds of doctors across the country to do this. So our center's Attention Learning Center, or Linden Attention Learning Center, like I said, I started in this field right out of college. I was lucky it started, and I'm a certified fellow, which is the highest ranking in BCI certification. We do a brain map on everybody that does this, because you need to know what to do. We have a neurologist look at every QEG just to make sure there's nothing abnormal like a seizure disorder. We monitor very carefully. We always do a baseline and a brain map in the middle and the end, and we meet in between. Why? Because we really want to individualize and personalize the neurofeedback. It doesn't happen now because of COVID, but years ago when neurofeedback started to get popular, centers opened where they ran groups of kids at the same time. Imagine having kids with ADD and autism and Aspergers in the same room with sensors on their head and one person monitoring 4 of them. I mean, it's part of what we do. We call them neurofeedback therapists. We're one-to-one because it's like behavior therapy. We have to prompt the kids and say, watch the screen, and we have to teach them how to do this, keep them motivated. We use a reward system. So some of the newer developments, as I was saying, we have a remote training. Sometimes I get people in the webinars that live far away, and we do the QEEG map first, and then we send you home with a very professional set of equipment, which you rent, and we run the sessions over the internet. We do it on a webcam, and we look at the readings, and all you do is you kind of hook your student up or yourself up, and then we have you come in once or twice, and I meet with you. I'm doing my meetings remotely, but we typically meet in person at regular intervals. So this is one of the obstacles. During COVID, it's been easier because people have had more time and the traffic's been better. So the other thing we look at is called sometimes a part of our summer program, but it's our accelerated neurofeedback program. And we kind of started this actually in March when the kids were out of school. Typically we run after school on Saturdays, but we start being able to run all day long because the kids were home. And we can start, earlier in the morning, and we can usually we do it twice a week, but we can sometimes do 3 times a week, or if somebody is in a time bind and they're from out of town, out of the country, 4 times a week. Some of the schools are starting in 7 weeks now. So, middle of August, I've heard. So, but the idea is to be ready for the next school year. However that is, whatever form that is, to be ready for school or re-entering society or going back to work instead of working at home, socializing. It's going to be an adjustment for all of us. So here are the main points to go over again. Just to see, this is not really a test, just to summarize. ADD and autistic spectrum disorder are biological genetic disorders. We know this now. QEEG and computerized testing leads not just to the most accurate diagnosis, but successful treatment plans. There are combinations and different types of EEGs of autistic spectrum disorder, 5 or 6. And neurofeedback is successful not just as a short-term treatment, but as a long-term treatment for ADD and autism and Asperger's. And we see a lot of overlap, especially with adolescents and adults that have ADHD and Asperger's and autism. So that's another pattern we see. So here's my question to you as we're finishing up. Can you predict the health of your brain?
No.
Now I'm going to differ with you. I think the answer is yes now, because we can look at the brain map and we can.
Oh, I thought you meant in terms of just for yourself without the brain mapping.
That's okay. It's okay.
Should individuals be
that's
trying
what most
to
people
project?
would say. That's what most people think.
Me too.
You really have to get testing soon, and this is a great time to do it because, who knows when everyone's going to go back to school in person, but we have time now. Now, what happens if you don't? The dropout rate is very high, even with ADD, 1 out of 3 kids. Getting through college is very difficult. A lot of students, young students, self-medicate themselves with marijuana and alcohol. Very hard to get through college, very hard to go away to college if you have autistic spectrum disorder. It's very hard to maintain a job. I mean, you can work at home, but if you have to socialize in groups, very hard. To have a significant relationship when you're older is very hard if you have Asperger's and autism. And like I said earlier, every couple years you hear about these shootings, and there's a certain percentage of them that come back and say this person suffered from ADD or Asperger's and they got teased and bullied and they got depressed. And the one that just happened a couple weeks ago in Northern California, the boy's dad said he had ADD and Asperger's and he had some other issues that got worse. So there can be some pretty significant, if you don't do anything. Focus on the true underlying cause and look at the brain, not just the symptoms with the brain map, and correct the brain dysfunction long-term, not just temporarily with drugs and medication. and do an individualized approach, because everyone's brain is different, and we have the technology to look at that now. And then what you do at the school and social skills groups and parenting is going to be a lot easier. But the biggest important thing is to do something now, like I did with my cousin, because it's always better to do it sooner, although I tell people it's never too late. So what is the next step? What's the first step? The first step is what we call an action plan. We used to call them a treatment plan, but it's an action plan. What that involves is typically having a meeting, and I do these all myself, mostly through remote Zoom, and we do some background history and family history and find out what areas we need to work on and what treatments you've tried, and we come up with goals. What do we want to work on? Everyone's goals are different. We have a computerized test of attention. With adults, we do test of memory. We do a personality test. We look for anxiety and depression. It's very important with adults because there's a lot of overlap with anxiety and depression. But the important thing is this QEEG brain map that we talked about a lot today. And what's the value, like they say in those commercials, or they MasterCard commercials? Priceless, because we only get one brain. And like I said, it's kind of a no-brainer to know what your brain's doing, especially if you have these things going on and you've been trying to figure this out or been down the wrong road with medicines or so. So what we typically do at the end of our webinars is if we have a couple people, we can take questions, but individually, we kind of offer you a consultation either on the phone or over the Zoom internet. But we have a promotion, and we're actually doing more right now because of coronavirus. I think we have 4 different promotions because we're really trying to help people because of the free time. The first option is, especially if you just have questions, is to do a free consultation, and you can go to our website and schedule that or talk to us. And we have extended this obviously to June 30th because it's past June 15th. So you can schedule that on our website, or if you hang around, we're going to be able to talk to you in person. If you want to do the testing now, and again, this is through June, end of June, we have a really significant offer, which is 50% off. And that includes all the things we talked about: the brain map, the computer test of attention and memory, the personality test, and then a long 1.5 to 2 hour meeting with me to go over the results and come up with treatment recommendations. We also have, and this, we were doing this in March and April when nobody was really, not very few people were going out. We were able to do most of our tests, especially with older adolescents and adults, over the internet. We can't do the brain map over the internet, but some people just for ADD or other things wanted a quick way. So we quickly, like a lot of companies did, figured out ways to do this remotely. Here I am. I think I've done every single session remotely since March 15th now. So it's been two months of doing, and it's kind of crazy. You would never think you could do it. I prefer to see people in person, but you know, it's the next best thing, I guess. And then sometimes we have people that have looked into neurofeedback or tried other places, especially now when we're getting into the summer, or weird summer. And we have an accelerated program where you can start right away and we can do things very quickly. One of the things you see in these last 2 options that says 25% discount CV, that's our coronavirus relief program. We started this in April and just decided, with all the different things going on with the economy and everything else, we wanted to make this more doable for people because there is the time and, you know, that free time and the flexibility that we've never really had before. That's the benefit and the opportunity, I think, with the situation as it is. So we do these sessions individually. We bring people in through the back door. A couple, I think, of you guys have been testing. But these are things we're doing through the end of June, which is in a couple weeks, I guess. And we're not sure if we're going to do it in July, but we kind of will decide that at the end of the month. So it's something, what we'll do is If any of you want, I have a couple people here and we can talk to you. We'll probably call you on the phone and we can set stuff up because since June 1st, we've gotten very busy. A lot of people have waited to come in and they're realizing that school starts early and things are getting, safer to go out. So we're actually getting really busy like we typically do in the summer. So this is an opportunity if any of you want to do that, at least schedule a free consultation or ask questions. So what I want to do is finish up and just say to you, don't wait for a crisis, although some of you could be in a crisis. Start the action plan now. The first step is just to make an appointment or a consultation. This is our phone number, our local number, 489-3233. This is our website, and if you register in the website, like I said, you can register for a free consultation.